I'm Dr. Jocelyn, and welcome to my channel. I know precisely why you clicked on this video. The title, How Many Inches Every Woman Wants Based on Science, speaks to one of the most persistent and anxiety-ridden questions I hear in my practice as a urologist. Be honest, in movies, in certain media, and in locker room talk, there's this constant, crushing pressure that bigger is the only way to be. This cultural myth creates so much stress, leading men to feel inadequate and causing a real condition we call penile dysmorphobia, WAPS. It's a body image disorder where a man perceives his perfectly normal anatomy as inadequate. Recent psychological studies indicate that up to 45% of men express dissatisfaction with their size despite falling well within normal ranges. This dissatisfaction often begins in adolescence, where exposure to unrealistic portrayals in adult content creates lasting psychological imprints. The average adult film performer, for instance, represents less than 2% of the actual male population in terms of measurements. Yet, these images form the unfortunate baseline for many young men's self-perception. My goal today is simple: to dismantle that myth, ease that anxiety, and give you the actual unvarnished science. The facts based on real research, not fantasy. The doctors, understanding the real baseline. To even talk about preference, we first need to know the baseline. And when I say baseline, I mean we must completely disregard the wildly inflated numbers you see in self-reported online surveys, which are notoriously unreliable. Studies have shown that self-reported measurements typically overestimate by 1/5 to 2 inches on average, a phenomenon researchers call wishful measurement bias. We're talking about large-scale systematic reviews where medical professionals, urologists, or trained researchers do the measuring. This is the bright gold standard because it eliminates exaggeration and uses a consistent, standardized technique, usually the bone-pressed method, which pushes the ruler to the pubic bone to account for the surrounding fat pad. This ensures accuracy across all subjects. The measurement protocol itself matters immensely. Professional measurements are taken in a warm clinical setting with erect size, with the patient standing at a 90-degree angle to the body, and measurements taken from the dorsal top side base. These controlled conditions ensure consistency across thousands of subjects from different ethnic backgrounds and geographic regions. So, what is the average erect length? Consistently, the research, including a major in 2015 meta-analysis covering over 15,000 men from multiple continents and ethnic backgrounds, places it in the range of about 1 to 5 inches. A subsequent 2020 review, incorporating data from 21,000 additional subjects, confirmed these findings with remarkable consistency, and their girth or circumference measured at the midshaft. That's typically around 5 to 7 inches. Interestingly, flaccid measurements show much greater variability, ranging from 8 to 9 inches. On average, with some men being growers, significant change from flaccid to erect, and others being showers. Minimal change. This variation in flaccid state often contributes to locker room anxiety, though it has zero correlation with erect size or sexual function. Now I want to emphasize the all-normal distribution array of these measurements. 95% of men may fall between approximately 5 inches and 7 inches in length. This means if you fall within that very wide range, you are physically normal. To put this in perspective, only 5% of men measure above 9 inches, and only 5% measure below 5 inches. Human biology is wonderfully varied, and being slightly above or below these central numbers is completely normal. The main takeaway here is that the average non-is the true medically measured average is much smaller than popular culture would lead you to believe. And that should be the first dose of reassurance for any man listening. This reality stands in stark contrast to the 9 or 10-inch expectations often set by media, proving those figures are exceptions, not norms. What women actually prefer, the science. To find out what women actually prefer, we turn to one of the most reliable and innovative studies ever conducted on this topic, published in the scientific journal PLOS One. This study was groundbreaking because the researchers didn't just ask women to think of a size or point to a 2D image. They had 575 women handle and choose from our 33 different lifelike three-dimensional models of penises printed in varying sizes. These models were created using advanced 3D printing technology in a cow-neutral blue color to avoid racial bias with realistic textures and densities that mimicked actual tissue. This allowed them to select an ideal size based on a feel and perceived fit, adding a haptic or touch element that previous studies lacked. The participants were diverse in age, ranging from 18 to 65 plus sexual orientation, though predominantly heterosexual, and relationship status, providing a broad cross-section of preferences. The models ranged from 4 inches to 8, 5 inches in length, and from short to 2, 5 inches to 7 inches in girth. So the women had the option to choose something truly massive if they desired. Crucially, the women were asked for their preferences based on 2 distinct scenarios. And this distinction is absolutely key to understanding female choice. Sajurchach, for a one-time sexual partner. The average preference was slightly larger than the general male average, approximately 6, 4 inches in length, and 5 inches in girth. The standard deviation was relatively small. 7 inches for length, and 5 inches for girth, indicating a fairly consistent preference pattern across participants. Now notice this is less than 1 inch longer than the established average. Scientists hypothesize that this slight bump up for a short-term fling reflects an evolutionary curiosity or a desire for a maximized intense physical sensation to ensure the encounter is memorable. From an evolutionary psychology perspective, this aligns with the sexy son hypothesis, the idea that in short-term mating contexts, women may prioritize genetic markers, even perceived ones, over comfort factors. It speaks to a novelty versus utility trade-off. A one-time partner is a novelty, and they choose a size slightly farther from the mean. For a long-term partner. But here is the most important finding, the one that should truly calm most men. For a long-term partner, a husband or serious boyfriend, the preferred size actually became slightly smaller. The average preference dropped to about 6, 3 inches in length, and 4, 8 inches in girth. This is the subtle but profound difference. Additional research from the University of California, TIC, and R. King's College London has replicated these findings, with long-term preferences consistently falling closer to average sizes than short-term preferences. Why the change? Because in a lasting relationship, factors like comfort, consistency, and avoiding pain become far more important than a momentary thrill. The vaginal canal typically measures between 3 to 6 inches when aroused, though it can expand to accommodate larger sizes through a process called tenting. However, repeated stretching beyond comfortable limits can lead to various issues. A penis that is too large can genuinely cause repeated physical discomfort, hitting the cervix, causing microabrasions, or creating a feeling of being overstretched. Medical literature documents conditions like vaginismus, involuntary muscle spasms that can develop partly as a protective response to repeatedly painful intercourse. Women instinctively account for this discomfort when selecting a partner they plan to be with long-term, choosing a size that is both pleasurable and sustainable. Over hundreds or thousands of encounters, this confirms that the ideal size for a lasting partner is one that prioritizes comfort and reliability over extreme measurements. The critical distinction, length versus girth. Let's zero in on a truly critical distinction that often gets lost in the conversation, the difference between length and girth in or circumference. If you look closely at the preferred numbers from the 3D model study, you'll see the women's ideal girth, around 5 inches, is getting remarkably close to their ideal length of for 6, 3 or 6, 4 inches. That's a powerful visual ratio. Other studies which have asked women directly which contributes more to your sexual satisfaction, width or length, have found that overwhelmingly the answer is girth, bak. As a urologist, this is completely anatomically sound. The human vagina is often described as a get potential space, meaning it expands and conforms to the object inside it. The vaginal walls contain specialized tissue called rugae, accordion-like folds that allow for this expansion while maintaining sensitivity. However, the most sensitive nerve structures that are crucial for female pleasure, particularly in the outer third of the vaginal canal, the area richest in nerve endings, are stimulated more effectively by fullness and stretch. The anatomy here is fascinating. The vaginal opening is surrounded by the bulbospongiosus and ischiocavernosus muscles, which respond to stretch stimulation. Additionally, the internal clitoral structures, including the clitoral legs, crura, and bulbs, extend around the vaginal opening and are compressed during intercourse. Greater girth provides more consistent pressure on these structures. Research using MRI imaging during intercourse has shown that girth creates more consistent contact with the anterior vaginal wall, where the controversial G-spot, actually the urethral sponge and Skene's glands, is located. Once a man is in the normal range for length, that 5 to 5-inch average, adding width provides a much greater physiological impact on pleasure than simply adding more length, which may just poke deeper into less sensitive regions like the white posterior fornix. If a man wants to focus on a dimension that truly matters for his partner's sensation, science says it's girth. The most powerful statistic, 85% satisfaction. Beyond those average preferences, we have the most powerful, anxiety-crushing statistic of all, and it comes from a massive internet survey of over 550,000 people, conducted across multiple countries and cultures. This study found that a staggering 85% of women reported that they were satisfied with their partner's penis size. Follow-up qualitative interviews revealed that most women who expressed dissatisfaction cited factors like hygiene, technique, or emotional disconnect rather than size itself. I want you to let that number sink in. Stacked 85%. Now, compare that to the men in the very same study, where only 55% were satisfied with their own size. Further analysis showed that men who were dissatisfied typically overestimated what women wanted by 20-30%. This reveals a profound disconnect. Men are carrying around a huge self-imposed burden of anxiety, worrying about something that their partners are, for the vast majority, perfectly happy and satisfied with. Additional research from the Journal of Sexual Medicine found that men's size satisfaction was more strongly correlated with their consumption of pornography than with their actual measurements. Men who consume pornography more than 3 times per week through eins were 5 times more likely to report size dissatisfaction regardless of their actual dimensions. This is definitive evidence that the problem is predominantly one of perception and media influence, and not one of physical reality. Narns you can be too big. And we absolutely must address the flip side that no one talks about. You really can be too big. A penis that is significantly longer than average, think 8, 5 or 9 inches or more, and risks consistently hitting the cervix at the back of the vagina, which is often painful and can shut down the entire sexual experience. It's a medical issue called dyspareunia, affecting up to 20% of women at some point in their lives, with size incompatibility being a contributing factor in approximately 15% of cases. The cervix, contrary to what some believe, is not a pleasure center for most women. It's actually quite sensitive to pain, containing nociceptors, pain receptors that trigger a visceral pain response similar to being hit in the testicles for men. Repeated cervical collision can cause cervical bruising, bleeding, and in rare cases, even cervical ectropion, when cells from inside the cervical canal grow on the outside of the cervix. Similarly, a very large girth can cause uncomfortable stretching, vulvar pain, or even microtears in the vaginal tissue or perineum. These tears, while usually small, can increase the risk of infections and make regular intercourse difficult and discouraging. Studies of couples where size incompatibility is an issue found that 68% and reported decreased frequency of intercourse and 34% reported complete avoidance of penetrative sex. Especially for long-term comfort, the pressure to be huge is not only unrealistic, but it is actually medically counterproductive to consistent, pleasurable, and healthy sex for the receiving partner. Gynecologists report that couples dealing with size incompatibility often require specialized counseling, position modifications, and sometimes even medical interventions like vaginal dilators or muscle relaxants. Sometimes the body's desire to avoid pain is why the preferred size is moderate, manageable, and slightly above average. And that's a beautiful, natural, evolutionary design. Steroids. What actually matters: emotional connection, foreplay, and technique. So if size, once you're squarely in the normal range, isn't the magic key that unlocks satisfaction, what actually is? Science, thankfully, is incredibly clear here, and it refocuses the conversation from anatomy to intimacy and behavior. Research from the Sadir-Kinsey Institute and multiple international studies consistently identifies the same factors. The most significant factors for a woman's consistent sexual satisfaction are not physiological measurements, but psychological and relational dynamics. Dr. Sparks, White 1, emotional connection. The first and arguably most important factor is emotional connection. This includes essential elements like trust, open communication, intimacy, and feeling genuinely safe and respected within the relationship. Studies repeatedly show that a woman's sense of closeness and comfort with her partner is the number one predictor of positive sexual experiences and achieving orgasm. In fact, women in emotionally satisfying relationships are 4 times more likely to report sexual satisfaction, regardless of their partner's physical attributes. Neurological research using fMRI scans shows that feelings of safety and emotional connection actually alter brain activity during arousal, increasing activity in pleasure centers while decreasing activity in areas associated with anxiety and self-consciousness. This bond dramatically outweighs any physical measurement because the brain is the largest and most important sexual organ. If a woman is worried, uncomfortable, or feels disconnected, no amount of size will compensate for that emotional barrier. The true measure of a partner isn't her length, but her ability to still connect and communicate openly. 2. Foreplay. The second critical component is foreplay. We're talking about the ability and willingness to engage in sustained, focused, non-penetrative stimulation and attention to the entire body. Research indicates that women typically require 13 to 20 minutes of arousal to reach optimal lubrication and vaginal tenting, compared to 3.5 minutes for men. The fact is, for the majority of women, studies consistently show 70–80% clitoral stimulation is necessary for orgasm, and penetration alone simply doesn't provide this consistently. The clitoris contains over 8,000 nerve endings, compared to 4,000 in the penis, and most of these are concentrated in the external glands. A partner who understands this anatomy and dedicates genuine time and focus to external stimulation and doesn't view foreplay as a quick preliminary step is going to be profoundly more satisfying than one who rushes to insertion. Studies show that lesbian couples who engage in significantly more non-penetrative activities report higher rates of orgasm, 86%, compared to heterosexual women, 65%. This demonstrates both care and knowledge. 3. Technique and effort. The third vital element is technique and effort. This is about being present, being sensitive to her needs, and actively listening to what brings her pleasure. It's the attentiveness to pace, pressure, and position. Research on sexual communication shows that couples who regularly discuss preferences report 32% higher satisfaction scores. A partner who is mindful and willing to adjust and explore different approaches, focusing their energy and attention on her pleasure rather than their own performance anxiety, is utilizing a form of technique that no physical attribute can replace. It is effort, not endowment, that wins here. The bottom line. The bottom line, based on everything we've discussed today, is that your anxiety about size is a far greater threat to your sexual health and your partner's satisfaction than the size itself. Performance anxiety can trigger a cascade of physiological responses: increased cortisol, decreased testosterone, reduced blood flow, that directly impact erectile function and sexual performance. A partner who is confident, attentive, and communicative will always be more satisfying and arousing than one who is bigger but distracted, self-conscious, and emotionally absent. You can control your confidence and your technique. You cannot change your size. To synthesize the scientific data, research suggests a modest preference for a size around 6, 3 inches in length, and 5 inches in girth. But the most vital piece of information is that most women are already satisfied with their partner's size. Furthermore, studies on relationship longevity show that sexual satisfaction based on emotional and technical factors tends to increase over time, while satisfaction based purely on physical attributes tends to decrease. This is the key insight I want every viewer to take away. Your focus needs to shift decisively from a fixed, immutable number to your technique, your confidence, and your connection. Those are the true variable and improvable indicators of a healthy, fulfilling, intimate life. Seeking help. If your anxiety around your size is causing you emotional distress, affecting your relationships, or leading to avoidance, please understand that this is a recognized health issue. Cognitive behavioral therapy has shown excellent results in treating penile dysmorphobia, with success rates above 170%. I strongly urge you to talk to a urologist or a therapist who specializes in sexual health. We are here to help and can provide genuine reassurance and therapeutic strategies to overcome this anxiety. Remember, sexual health is an integral part of overall health, and seeking help is a sign of strength, not weakness. If you found this information helpful, please like this video and subscribe for more medical insights. Dr. Jocelyn.